We're going to be talking about how we feel safe in our bodies. And we can only really do trauma work if we are feeling safe in our bodies. So let me explain that. So when you work with somebody on whatever trauma or traumas you've experienced, one of the first things they're going to do is they're going to connect you with how it feels in your body, which we talked about a little bit in the first segment. And then we talked about also how that's connected to the negative cognition. Feeling safe in your body means you have to really get in touch with what comes up for you in your body when you're experiencing that trauma reaction. It's really easy sometimes for people to identify the anxiety or to identify that I'm really sad or depressed about it or I'm not sleeping. But it's harder for people to understand how that is in your body. And so once you can get to a place with whoever you're working with, and some people will go to Reiki and do somatic experiencing and different things to get there, but you'll start noticing when I feel anxious, I feel it in my chest and I feel like I can't breathe. Or when I feel sad, I feel it in my throat and I feel like I can't get the words out. So before you start doing that trauma work, you're going to do a lot of resourcing, a lot of exercises around regulation and how to calm everything down. I say all the time, and I've probably already said in other segments, that trauma survivors have a superpower. And that superpower are these antennas where we pick up on so much, and it can be overwhelming and picking up on other people's energy and what other people are experiencing. We're very empathetic to what other people are feeling, but what also happens is we carry it. And so what I always say is if you're carrying all of this, whether it's vicarious trauma through the work that you do, or whether it's your own trauma, take that out and look at it and name it. There's something called Gestalt therapy, which allows for you to take that feeling that you're feeling in your body and put it in a chair and actually talk to it and give it a name. But we've got to be in touch with what's going on in our body. And only when we feel safe there can we then connect to others. And we'll talk about that connection in the next segment. So just take a moment and take a deep breath and close your eyes and do a body scan. That is super helpful. And then start to recognize where things are coming up for you in your body. And that's a great start. Thank you again for joining me today with Tea Time with Dr. T. I look forward to seeing you again in the next segment.